Welcome to the deep dive. So today we're tackling something, something that sounds simple, but really isn't. How do we actually see justice in society?
It sounds straightforward, doesn't it? But it's deeply complex. We're digging into some really fascinating research by Karen Hegtvedt. She points out that, justice is obviously
No,
crucial.
we talk about it all the time. Health, education, racial dynamics.
Exactly. But Hegtvedt noticed it's often pretty vaguely defined in a lot of academic work. So she asks these really sharp questions. Are sociologists actually focusing on justice? When they do, is the concept clear? And maybe could social psychology give us a better lens?
A clearer way to see it. We'll
Yeah.
definitely unpack her answers. But let's start with that powerful line from Judge Bertram Schmitt, and you mentioned it earlier. Justice has to be seen to be done.
Right. Judge Schmidt really emphasized that justice isn't like a law you can just point to. It's abstract, complex. He used the Ongwen trial as an example to show how these concerns play out
Okay,
differently.
how so?
Well, you have the micro level, like the personal experiences of victims and defendants, then the meso level, which is more about organizations or courts themselves, their actions, and then the macro level, which is the big picture, the wider societal consequences, how institutions are affected. It operates on all these scales at once.
So if it's that abstract, how do we pin it down? What does social psychology offer to help us, actually see it clearly?
It gives us three pretty specific types, which really help sharpen the focus. First, there's distributive justice.
Okay, so that's about fair outcomes, like everyone getting their fair share, equitable pay, that sort of thing.
Precisely. Then number two is procedural justice.
Yeah.
This is all about the fairness of the process used to make decisions.
So not just what decision was made, but how it was made. Was it impartial? Did people get a say?
Exactly. Representation, accuracy, impartiality, those are key. And the third one is interactional justice.
That sounds like it's about how people treat each other.
Yeah, fundamentally, it's about the fairness of interpersonal treatment. Are you treated with respect, with dignity, with kindness?
Right. Like the example of a doctor delivering bad news, how they do it, really matters to your sense of fairness, even if the news itself is the same.
Absolutely. That how is crucial. And this level of precision is so important because Hegtvedt found something quite striking when she looked at major sociology journals.
What was that?
Well, sociologists are clearly focused on inequality. Something like 39% of articles mention it. But explicit talk about justice, it was often less than 1% in article titles. Really low.
Wow, that's a huge gap.
It is. And there's this tendency to use terms like, say, health inequality and health inequity almost interchangeably. But doing that, you lose conceptual clarity.
You blur the line between just a difference and an unjust difference.
Exactly. And if you can't clearly see the injustice, how can you possibly figure out how to address it effectively?
That's such a critical point. If academics are fuzzy on the definition, it's hard to tackle it in the real world. So how does Hegtvedt suggest we bridge this gap using those social psychology concepts across the different levels?
She
He uses health examples,
She
right?
does, and they're really powerful. So let's take the micro level. Think about a doctor's visit, that patient-provider interaction.
Okay.
Research indicates, for instance, that white physicians who hold implicit racial biases might speak faster or communicate in a less patient-centered way with black patients. Now, that's not just a communication difference. Hegtvedt argues it's a violation of both interactional and procedural justice, and it has real consequences, less trust, maybe poorer health outcomes.
I see. And then the meso level, that's like organizations.
Right. Think about a hospital. How administrators decide on budgets, that process can involve procedural justice ideas like accountability for reasonableness. Are the decisions made transparently, fairly?
Or like community level stuff too.
Definitely. Like during the pandemic, when some marginalized neighborhoods had way fewer COVID vaccine sites, that's a clear example of distributive injustice, unfair distribution of a vital resource.
Okay, micro, meso. What about the macro level?
So macro connects to those big picture social determinants of health, housing, education, environmental factors, all those larger structures.
Yeah.
Addressing health inequities, the unjust differences, really requires tackling things at this macro level. Social justice becomes, well, a prerequisite for genuine health equity.
Wow, these examples really drive it home. How our perception of fairness or unfairness, whether it's in a clinic, a hospital budget meeting, or just how resources are spread across a city.
Yeah, those perceptions matter. They can trigger responses, individual actions, changes in how organizations work, even shifts in national policy. It all connects back to whether justice is ultimately seen to be done.
So thinking about all this, what's the key takeaway for you listening right now, trying to make sense of the world?
I think it's about getting that clarity, really understanding what we mean by justice, moving beyond just noticing inequality to actually seeing the injustice. Is it distributive, procedural, interactional?
Because once you see it clearly,
Then you can understand why it's unfair. And crucially, it starts to show you pathways, actual ways justice can be done. It moves from just identifying a problem to figuring out a solution.
a really profound thought there, maybe something for you to chew on. How many of the problems we talk about in society, the big issues, are actually rooted in some form of unacknowledged injustice, just waiting for us to really see them?